All right, hello. We're gonna do the assessment on your eyes, ears, nose, mouth, and throat today. So first, I'm gonna ask you a few questions about any eye pain or discomfort that you may have had in the past. And you just let me know if you've had it or if you have not had it. Are you having difficulty seeing or any blurry vision?
No.
All right, any eye pain?
No eye pain.
Any history of cross eyes?
Nah.
Any duplicate vision?
Nah.
Okay. Any redness and swelling of the eyes?
No.
Any excessive tearing or watering?
No.
Okay. Have you been tested for glaucoma?
No.
Do you wear any glasses or contacts?
No.
And then have you ever had your vision tested?
Yes.
And do you take any medications at this time?
No.
Okay. All right. So first thing I'm going to test is your peripheral vision. If you could cover one eye for me and let me know when you see my finger come back into your vision, okay?
All right.
All right. You should be able to see it.
Yeah, I see it.
Okay. Right here.
Yeah,
Can
I
you see
see
it?
it.
Okay. Can you see it on this side?
Yep.
Okay. And we're right here.
Yep.
Okay.
No,
that's fine. All right, now I'm going to test your reflexes to make sure that your pupil does dilate and constrict. Good. Good. All right. Now I'm just going to make sure that your outer structures are aligned, with your eyes are both aligned to your ears, your nose is aligned with your face, and your nose is as well. All right. Now we're going to test to make sure that your eye muscles do work properly, and follow my finger this way. All right, and follow it back here. All right, follow it here. All right, good, and one time here. Good. All right, so now I'm going to check the bottom of your eyelids. I'm going to place my thumbs up under your eye, and then I'll place them at the top to raise your eyelids, okay? Make sure they are the right color. And then at the top here. Okay, good. So now we're going to test your, make sure that you don't have any inflammation in your tear ducts. And your tear ducts are here, so I'm just going to press slightly here. Okay, good. Next, I need for you to look at something on this wall here, and then I'm gonna test your reflexes of your cornea and your eye and your pupil. Good. Okay. Next instrument we're gonna use is the scope here to look behind the eye, make sure all of the muscles in the internal eye are normal. All right, again, just look past me at something on that wall. And I'm gonna look here. Good, and it looks great. I'm gonna test this one. Yep, and I can see that the inside of the eye is within normal limits. Looks good. Active to light. All right, now we're gonna move forward to the ears. All right, again, I'm gonna ask you a few questions regarding any past history of your ear. Have you had any earaches or ear pain?
No.
Okay, any trauma to the head?
No.
All right, any ear infections?
No.
Now or in the past?
No.
Any discharge from the ears?
No.
Any recent hearing loss?
No.
All right, any ringing or buzzing in the ears?
No.
Vertigo, okay. No. Any spinning
no.
when you stand up? Okay. And then how do you clean your ears? What do you use to clean your ears?
I use a rag and warm water and soap.
Okay. Okay, that's good. All right, so we're gonna get the otoscope for this and just check the inside of your ear.
I know it.
But I can see here that your ears are symmetry to your face, and they are equal size. And I'm gonna come over here and take a look at the inside of your ear. Lift it up. have a clear tympanic membrane. I'm going to check your other ear here. Alright, and that one looks good as well. So next thing is what's called a whisper test. I'm going to close one of your ears and I'm going to whisper a combination of letters and numbers. Let me know, you can repeat it back to me to let me know that you did hear it, okay?
Alright, no.
Alright, I'm going to close this one. 1, 5, 6.
1, 5, 6.
Okay, I'm going to close the other one. 1, C, 7.
1, C, 7.
Great. Great. So you can... Alright. The next assessment is going to be on the nose, mouth, and throat. Alright, again, I'm just going to get a little health history on your ears, mouth, and throat, and then we'll move forward with the examination. Any nasal discharge?
No.
Alright, any severe colds?
No.
Any sinus pain?
No.
Or sinusitis, which is an infection or inflammation of the sinuses? Any trauma or injury to the nose?
No.
Any nosebleeds?
No.
All right, any allergies?
No.
All right, any changes in your smell?
No.
Any sores in the mouth or tongue?
No.
All right, any sore throat?
Not at all.
Bleeding gums?
No.
Any hoarseness or voice change?
No.
And any difficulty swallowing?
No.
All right, do you smoke?
No.
Drink alcohol?
Yeah.
Okay. How many times per week, if you had to say?
Not a lot.
Okay.
Yeah.
So like occasionally?
Occasions, yeah.
Okay. And do you use any nasal sprays?
Only when I'm sick.
Okay.
Yeah.
All right. So have you had used any recently?
Yes.
Okay. Recently you had a cold?
Yeah, like 2 weeks ago.
All right. Now we're gonna move forward to the nasal assessment. First, I'm gonna just start off by examining that your nose is symmetrical to your face, and both nostrils are symmetrical. Now, first, I'm gonna close one nostril, and then I'm gonna ask you to sniff to make sure that you don't have any obstruction. Okay. All right. Good. And the next one. Wonderful. All right. So then I'm gonna take this. I'm just gonna look in there to make sure everything's smooth, moist, and without any polyps. Okay. Great. Thank you. All right, now I'm gonna palpate your sinuses to make sure they are not inflamed. One is here, up above the eyes, and then above the forehead, and up under the cheek. And they don't feel swollen or inflamed. All right, next thing we're gonna examine is your mouth and your gums. All right, if you can just say "ah" for me. I'm gonna look here. Look at your tonsils; they look good. I might be a little swollen right now. Okay. Now, if you can lift your tongue up to the roof of your mouth. Good. Okay. And that'll be it. All right. Hello. We're gonna move forward, and we're gonna go ahead and do your breast examination assessment. I'm gonna ask you a few questions about your health history. All right. Have you had any pain or tenderness in the breast?
No.
Any lumps or thickening in the breast?
Yes, in 2007.
2007, there was a lump, a benign lump.
Yeah, my left breast.
Left breast. Any discharge of the nipples?
No.
All right. Any rash of the breast or swelling?
No.
Any trauma or injury or radiation to the breast?
No.
Any history of breast disease?
I have cystic breast.
Cystic. Had any surgery on your breast?
No.
And have you ever been taught breast self-examinations?
Yes.
Ever had a mammogram?
Yes.
And when was your last one? All right, hello, we're gonna move forward and we're gonna go ahead and do your breast examination assessment. I'm gonna ask you a few questions about your health history. All right, have you had any pain or tenderness in the breast?
No.
Any lumps or thickening in the breast?
Yes, in 2007.
2007, there was a lump, a benign lump.
Yeah, my left breast.
Left breast. Any discharge of the nipples?
No.
All right, any rash of the breast or swelling?
No.
Any trauma or injury or radiation to the breast?
No.
Any history of breast disease?
I have cystic breast.
Cystic. Had any surgery on your breast?
No.
And have you ever been taught breast self-examinations?
Yes.
Ever had a mammogram?
Yes.
And when was your last mammogram?
I can't remember.
Okay.
It's 20 something.
Okay, so not recently.
No, it wasn't last year. It
Okay.
wasn't 2019 or 18.
Okay.
Because after the last one, they said you had to wait. I think it was like 10 years now. It used to be annual, but
Yeah.
now they're not doing it annually.
Yeah, it's like every 3 or so, something like that. Okay. And then the age of your first birth.
27.
Are you taking any hormones at this time?
No.
Okay. All right, now I'm going to describe what is done at a breast examination. I'm not going to do yours physically, but I'm going to just explain to you what we do. They do check for retraction.
What is retraction?
Retraction is when the breasts don't move upward. I'm going to ask you to lift your arms, and you would lift your arms, and both breasts should move upward together symmetrically.
When I lift both arms or one arm?
Both arms.
Okay.
Both arms. And then the next thing is where you would place your hands on your hips, and I would check your breast to make sure that the muscle, which is the pectoris major, is normal.
Okay.
Then you would place both of your hands together like this, and I will also check the same muscle on your chest. Men, you can see men's a lot better than women's, so I will check that muscle. The next thing will be checking under your arm for any lumps. You have lymph nodes there, so I would palpate here up under the right arm and then palpate under the left arm to make sure that they don't have any lumps. And I would do it in 4 different directions with my 3 fingers. Also, I would do your breast tissues with 3 fingers, moving in a vertical line, upward and then downward, upward and downward, or a figure 8 motion, making sure that there are no lumps in your breast going upward and downward.